Good morning. So coming second on the panel after Christie's not a great spot to be either. Thank you for that, though. And I want to say thank you to the Institute of Medicine for the opportunity to contribute to this study and for including home visiting as an essential part of the continuum of services for birth to age 8 and families. We had an opportunity for a few members of the committee to come to Chicago last week to do a site visit and gather some more information about the issues that the study is addressing. And they came to one of our programs, our Educare Center on the south side of Chicago, and had a chance to sit with a few home visitors. And during the interviews, I was struck again with how the home visitors attribute their skill and their ability and their work first and foremost to their personal characteristics and to the things that they learned in their own family. So I really played with the idea of only having one slide and saying the best preparation for the early childhood workforce is a good experience in early childhood themselves. But I thought that would be a little bit too facile, so I am going to share some other information with you beyond that. But I do think it's an important element to consider is the qualities and characteristics that come in to the individual doing the work and the context in which they have to do it. Now, at the Ounce of Prevention Fund, we're focused exclusively on early childhood with an emphasis on programs that support children and families in poverty prenatal through kindergarten entry. As the evidence base and public support for early childhood programs has grown, we've just continued to explore different program designs and how they work in diverse communities in Chicago and across the state of Illinois, but also across the U.S. Our journey really began in the early 1980s, and it started with home visiting programs for teen moms. Our primary interest was and continues to be developing, implementing, and continuously improving programs that can produce meaningful outcomes for young children and their parents. These are really two-generation approaches that we often forget about, but in a home visiting setting, you have to remember the parents, because they're the ones that open the door when you knock, or don't. We lead a network now of 30 home visiting programs that serve about 2,000 families in Illinois every year, and we do that with partner organizations that are based in communities throughout the state. From our perspective, rather than attempt to build a separate evidence base for a model of home visiting, we've chosen to focus on what works across the various evidence-based models and developed expertise in the implementation and the preparation of the workforce in those models, including Healthy Families America, Parents as Teachers, Nurse-Family Partnership, Early Head Start, and what's known as the community-based doula approach, which we helped to develop in the late 1990s. The measures of success for these programs include a range of short and long-term outcomes that are associated with school readiness, child development, and parental success. And I think those are probably very familiar to those in the audience, so I won't go further into that. But I just wanted to say that we figured out really early on that professional development was going to be a critical factor in getting those outcomes with kids and parents. So we started right away to build an approach to supporting the home visiting workforce in our own sites. And this part of our work grew over the last 15 years, and so now the Ounce Prevention is the primary professional development provider for all the home visiting programs in Illinois. There are more than 300 programs, and we're training thousands of home visitors every year. We also facilitate, in partnership with our colleagues at 0 to 3, a national community of practice for home visiting state leaders under the McVie federal program on the issue of professional development for this workforce. And that's been a wonderful opportunity for us to hear about and learn with our colleagues about what's going on across the country. And everybody's got the same set of questions and is really struggling trying to figure out what to do. In these next few slides, I want to share what our system for professional development looks like and really try to help you understand what the core assumptions we are basing the system on and what are some of the key elements in the approach. So we begin with these core assumptions that achieving outcomes from any evidence-based model requires you to implement that model with fidelity, pretty straightforward, and that fidelity requires professional development to nurture and master competencies. And that those competencies will include both what are considered hard and soft skills, and that those competencies are applicable across models. They are not that model specific. We think that professional development has to be intentional, outcome-oriented, continuous, and that there are factors that are important drivers for us in the development of a fully realized PD system for home visitors and supervisors and program managers. So I'm going to kind of go there with you, and let's see how this works. So I'm going to linger on this slide a good bit here and really share with you where our focus is on building competencies, how we think about using embedded routines for continuous learning in our system of PD, and how we think about the context in which these programs exist and the leaders of those programs, building also a little bit on what Christy mentioned earlier. So when we think about what are the competencies that we're trying to develop, we documented a set of competencies back in the late 1990s, and we updated them again in 2007, and those really formed the foundation for all of our PD work with home visitors in our state. These competencies require the building of content knowledge in the areas of child development, sorry to use that word again, maternal and child health, mental health, substance abuse, domestic violence, and family dynamics. One of the challenges for home visitors is that they're expected to know everything. Everyone thinks, wow, well, the home visitor is going in there already, so why don't they do the well child checkups, and why don't they bring in information about community resources? And the next thing you know, the home visitor's approach and focus on the parent-child relationship attachment is diffused in 1,000 directions. We also know, besides the content knowledge, that home visitors need process skills, and some of those that we think are really essential are the development and use of relationships as a vehicle for change, listening skills, and self-awareness and reflection. I'm not going to enumerate the competencies further than that. I'm happy to share the whole set of them, as well as examples that we have from other states through that McVie-funded community of practice for PD. We've got a little stockpile of examples of competencies that are being developed across the country and by national credentialing bodies who are thinking about this approach. I think it's important from our perspective to realize that home visitors enter the workforce from a variety of disciplines: the social work, psychology, sociology, anthropology, and early childhood ed. And this kind of interdisciplinary approach and input brings a lot of strength to the system as a whole, but it really creates a challenge because there's no baseline for a coherent PD system. Things cannot be stacked on top of a baseline that is that broad. I also wanted to point out for you that the competencies that we seek to develop are focused on the knowledge, skills, and attitudes that home visitors need to both be effective and to feel confident. That combination of competence and confidence is really important for this kind of work that involves being essentially alone in a community setting, in a family's home. And that feeling is an important issue for us, and our professional development is designed to help develop and incite and support that feeling of competence and confidence in combination with each other. Our system of PD really reflects a combination of highly specific vocational training mixed together with this motivation, support, and acknowledgement, and it's built on principles of adult learning in the multiple contexts. So this gets us into thinking about what are these embedded routines for learning. We think that home visitors and program supervisors have to learn the what and the how, but also the why of the model that they're using. And I often call this drinking the Kool-Aid of their model. Their knowledge and skill development really parallels the stages of implementation science. So when they come to their basic training and they first get their first sips of the Kool-Aid, they're in the exploration and adoption phase. And full implementation and innovation can only come with mastery of the competencies, which takes place over time, as I think everyone can understand. Our system really tries to engage the workforce in 3 learning contexts: training to build knowledge, a transfer to practice context that really includes coaching, supervision, and consultation with a variety of experts, and a third context, which is reflective groups, where you're consolidating learning, building self-awareness and your professional identity, making a connection between what you experienced in early childhood and what you're expected to do next. I'm going to jump ahead here, and the last thing on this slide I wanted to point out was that our focus on developing both people and programs is really powerful for us. We know that the context in which people are working is really important. We love this logic model from Heather Weiss's group at the Harvard Family Research Project, and I think you can see here we're talking about the staff professional development, but we also spend a lot of time thinking about organizational capacity and policy support as an organization. But when we see these contextual influences here, that's where the family, the child, and the community come into play and really have a tremendous impact on changes in parental behaviors, which is what we're after. If we're trying to change practitioners' behaviors so that they can engage with parents and change their behaviors. So I just really wanted to get this last one in here. These were our ideas for supporting a stronger workforce. You can read those on your own time because I've got a big 0 right here, so I am out of time. But I just want to thank everyone again for the opportunity to contribute and look forward to hearing the rest of the panel. Thank you.